Originally trained in Chinese medicine, he now studies the placebo effect and believes it's far more subtle than just pills and the power of belief. It's everything else that goes with the treatment.
We know that placebo effects underlie lots of medicine. And I think one of the things about looking at the placebo effect from the perspective of ritual and drama is that it's not only the pill and the procedure, it's the doctor, it's the patient, it's the dance they're engaging in, it's the room, it's the ambience, it's the waiting, it's the smell, and it's the context of a narrative that the patient and the provider construct between themselves. The context of what's going on here is a loaded, charged issue of very momentous, often very momentous importance to patients.
So for Ted, it's not just the treatments he's referring to. It's the whole ritual surrounding the therapy that enhances the belief that it will work. Something he calls the healing drama. I've asked him to observe a reflexology session to show me what he means.
What am I to expect?
You're going to relax.
Okay.
And you may feel things.
Okay.
And if you feel things, energy moving through your body, please tell me.
And will it help the asthma as well?
It's going to help your lungs to find a place of balance.
Okay.
So, yes, in that respect it will.
All right, great.
Let's leave now.
Okay, you've seen enough.
Is your neck a little bit stiff sometime, or do you hold tension in it?
I hold quite a bit of stress in my upper body and my neck.
How would you break down the different elements that contribute to that ritual?
No, I think, like any drama, there's great props. You have the lavender smell.
The smell.
You have the lighting, the charts, the visual props, right? The lighting is soft ambience, really gentle, and the foot chart that shows that we're doing something very important. And there's a whole theory and structure and science, if you want to call it a science, behind it. And then the touch becomes amplified through words and gestures and communication.
The more you continue, the more relaxed and the more loose the muscles get.
It's terrific when you respond like this.
I'm actually feeling a sensation of the stomach, right under the
In your liver?
right in the liver, yeah.
That's right where I was.
Really?
Yes. You're good.
Valerie's asking for feedback. Do you feel this? And Kim says, oh yeah, I do feel it. And where do you feel it? And then Kim gives back the feedback, or Valerie says, it's in your, you feel it in your neck. And at different points, Kim actually will say, well, I really feel it in my stomach. I really feel it in my shoulders. I really feel it in my neck. And it's like, wow.
It feels like an internal massage. It's so, I can definitely feel the difference.
There's a whole story here that's being given to the patient, a narrative, and the patient's participating in.
Breathe and throw that stress right out through your feet. Just let it come out.
And I could definitely feel the movement from the shoulders to the chest, to the stomach.
Good. Good. See, it is loosening up here.
Would you say this was just as real as taking a drug?
Is this legitimate medicine? I think at Harvard Medical School we'd probably say no. But sometimes just the ritual can have an effect bigger than a real active medication. And we actually know in terms of asthma, when people are given a bronchial dilator and told it's going to make them worse, they get worse. And when people are given something that would normally make them worse when they inhale it and are told it's going to make them better, they get better. So we know that these kinds of effects exist.
So some might say that's all there is to reflexology, that the ritual and the belief that surrounds it creates a powerful placebo effect. And from a scientific perspective, a lot of people might think I should stop this exploration into reflexology now, that there's no good science behind its main idea, and that there is a perfectly good alternative explanation for how it might help people. But actually, I'm not stopping my investigation now, because other mainstream scientists are still studying reflexology, but they're studying how to use it in quite a different way. 3 years ago in Hull on the Humber Estuary, Susan Clark faced a terrible shock.
I went for a routine mammogram and found out I had a lump. I thought, oh, I've only got a little lump. I'll be okay. So I went in thinking I'd be okay. And when he told me, I can't explain really how I felt. Just numbness.
Susan had been diagnosed with breast cancer.
Didn't get a real lot of support from my family because I think they was, I don't know, frightened or they didn't want to know. They wanted just for it to go away.
Then Susan came under the care of Professor Leslie Walker.
The diagnosis of cancer is not just about the biology, it's also about how people cope and how those round about them are affected also.
He was pioneering the use of psychological support for breast cancer patients.
We had shown about 10 years ago in women with locally advanced breast cancer that relaxation methods improved mood, improved quality of life, enhanced coping during chemotherapy and also during radiotherapy.
At first, Professor Walker tried to get his patients to practice relaxation exercises on their own, but it didn't always work.
It's not for everybody. There are a proportion of people for whom it just doesn't click. And so we have been looking for alternative relaxation-based methods.
So Professor Walker turned to reflexology. It's been increasingly used in other cancer centres because of its reputation for being particularly relaxing. In the largest study of its kind in the NHS, he decided to investigate reflexology by comparing it with another technique, head massage. All patients also had access to a drop-in centre and helpline for psychological support.
By comparing the responses of the women who got scalp massage and those who had foot reflexology, we could see if there was something which could be attributed to the extra social and physical contact or to stimulation of the reflexology points in the feet.
Claire came through and said, oh, I got reflexology for 8 weeks on this trial. I found it really, really good because it is relaxing. You feel like at peace with yourself. You don't feel some knotted up inside of you. It helped me, like, not to be too stressed out.
Is that pressure okay?
Yeah.
The early results of the study were intriguing. Both reflexology and head massage seem to offer some benefits.
There certainly is something in these methods. They have beneficial effects on relaxation and on quality of life. But none of our comparisons of reflexology and massage really indicated any significant differences between these two interventions.
So what might you conclude from that the findings for reflexology and for massage were quite similar?
I would say to conventional doctors, the effects are not huge, but although the results don't demonstrate huge effects, they are statistically and clinically significant, and they need to be taken seriously.
Now, this is just one study, but it is a large, well-designed trial. For these women, massage, including reflexology, seems to have helped them cope with the emotional burden of their illness.
The thing is, the effects, were quite small. And the trial hasn't been published yet. And the reflexology produced kind of similar results to the head massage. So, this possibly being more about touch and massage rather than the specific thing about the feet is what it might be suggesting.
Professor Walker's study has made me want to take my journey in a slightly different direction. I've decided to put reflexology to one side just for a moment and have a look at massage and touch. Now, it says here there are over 80 different kinds of massage. There's sport massage, there's trigger point massage, there's even rolfing. It sounds like fun. Don't know what it is. And it looks as though some studies show that, well, suggest that massage helps with well-being, at least in the short term. But nobody seems really sure what it physically does to you, what's actually going on in the body. But there are some top scientists who are trying to find out.